We're going to take our blue probe, and now on the screen you're going to see the actual probe in virtual reality. On the bottom right of the screen it says distance to bone. I'm within a millimeter, so I'm in the white. That's good.
I believe the future is here. At least at Robert Wood Johnson's Hamilton Hospital, they have a robot. And no, it was not funded by Skynet, I asked.
Of course you did.
So this robot arm is known as Makoplasty. It costs a cool $1 million. It aids surgeons primarily with partial knee replacements and hip replacements. The surgeon uses a 3D image on a monitor and controls a robot arm to be as precise as humanly possible. Imagine playing a game of Operation, and the robot arm actually takes the human error out of surgery. Instead of you using the little tool and buzzing on the side, the robot arm will completely shut down if you go anywhere other than where you're supposed to be. Considering the plethora of medical malpractice cases, doctors and surgeons being walking lawsuits, this robot arm could potentially save a lot more than knees and hips.
This is a robotic assistant for the operating room.
So Dr. Michael Ask told me exactly why help from the Mako is better than just surgery alone.
The same reason that I use my GPS when I'm driving somewhere instead of reading an old map, this is just using modern day technology to improve on the techniques we already have.
But I did the last best question for Dr. Schnell. Now, can Roy become self-aware?
Roy cannot become self-aware.
Who here has been operated on, and would you be comfortable with a robot arm instead of a doctor?
Absolutely not. It's great for movies, but I don't want a robot on my body. You said that actual doctors are walking lawsuits. Isn't this robot just a mechanical lawsuit waiting to happen?
Well, not really, because the robot itself takes a human error out of it. If a surgeon were to sneeze or slip or something, that would completely be stopped by this robot's
functions. Because machines
functions.
never malfunction.
My question is for the future. I mean, if there's an increasing use of robots in operating rooms, does it reduce the cost of health insurance, the cost of doing business at hospitals?
Right, absolutely. Automation right now, this robot has to be used in conjunction with a surgeon pretty much controlling what it does. I'm sure 10 years from now, look at what's happened in the past 10 years, there might be a self-aware surgical robot going on. Insurance might be an all-time low.
That's all right.
You know, we see Easy Pass taking over the role of toll collectors.
Right.
We see robots taking over the role of surgeons. What does the world need us for anymore?
Somebody has to report on it and chase the story.
Oh, right.
We'll always be here, Ronica. Don't worry.
I don't know about that. There's going to be chasing with drones.